Hello everyone, welcome back to our channel. Today, we're going to dive into the fascinating world of electrophysiology studies. We have with us nurse student Hassan, who will be sharing some valuable insights on this topic, about what an electrophysiology study is, its indications, complications and lastly nursing interventions. So stay with us and don't forget to like, share, and subscribe to our channel for more valuable content. So, Hassan, could you please explain to our viewers what an electrophysiology study is and how it examines the heart's electrical activity?
Absolutely. An electrophysiology study, also known as invasive cardiac electrophysiology, is a series of tests that provide a detailed examination of the heart's electrical activity through cardiac catheterization. Essentially, it allows us to create a comprehensive map of the signals that control the timing of the heartbeats.
That's really interesting. Could you elaborate on the specific functions and applications of this clinical electrophysiological study?
Of course, the EPS is used to assess the function of the sinus-nodal, AV nodal, and His-Purkinje systems, as well as to detect any ectopic electrical function. Additionally, it helps in making informed decisions regarding the placement of pacemakers or implantable cardioverter defibrillators.
Now, let's talk about the indications for undergoing an electrophysiology study. When might a healthcare provider recommend this procedure?
Well, an EPS may be recommended for individuals diagnosed with arrhythmias such as supraventricular tachycardia or other types of tachycardia, as well as for those who have experienced syncope or those who are at risk of sudden cardiac death. It is also necessary before undergoing cardiac ablation to pinpoint the area of the irregular heart rhythm. For ablation, the frequency waves are used, and if patient has heart surgery, cardiac ablation and an EPS be done on the same day.
Thank you for elaborating on that. Now, let's address the potential complications associated with an electrophysiology study. What are some of the risks involved in this procedure?
Well, there are several potential complications, including infection or bleeding around the heart caused by damage to the heart tissue, or damage to the heart valves or blood vessels, or damage to the heart's electrical system which could require a pacemaker to correct, blood clots in the legs or lungs, heart attack, stroke, and in rare cases, death.
Moving on, how should patients prepare for an electrophysiology study?
Patients undergoing an EPS should typically have blood tests and an electrocardiogram conducted a few days before the procedure. They are usually advised not to eat or drink anything after midnight for 6 to 8 hours before the EPS, and may be required to shave the puncture site and empty their bladder before the procedure. It is also crucial for patients to consult with their healthcare provider regarding the use of any medications prior to the test.
Now, let's delve into the actual procedure of an electrophysiology study. Can you explain the electrophysiology study procedure in general?
Certainly. The EPS is performed in an hospital by a team comprising a cardiologist, technicians, and nurses. The procedure involves the insertion of catheters into various areas of the heart to record its electrical activity and responses. Additionally, different tests may be conducted during the EPS, such as measuring the heart's electrical activity, administering medications to observe their effects on the heartbeat, and ultimately performing cardiac ablation if necessary.
Thank you for elaborating this, but can you walk us through the steps involved in conducting an electrophysiology study?
Certainly. As I told, the EPS is performed in a hospital by a team comprising a cardiologist, technicians, and nurses. The procedure involves the insertion of an IV line in the hand or arm, placing monitors or electrodes on the chest to check the heartbeat, and before the procedure starts, typically receiving a sedative through the IV line, and electrodes and the blood pressure cuff are often attached to the patient for monitoring purposes. During an EPS, long thin tubes called catheters are placed in 3 or more heart areas under fluoroscopy. A care provider checks the site where these catheters will be inserted, usually in the groin or sometimes the arm or neck, and then numbs the area. The intervention cardiologist inserts plastic tubes similar to large IVs called sheath into a blood vein. The catheters are guided through the sheath up to the heart, often using moving X-ray images as a guide. Sensors on the tips of the catheters send small electrical signals to the heart and record the heart's electrical activity and reactions. The catheters are then removed and the results of the study analyzed. For some patients whose arrhythmias can't be managed with antiarrhythmic medications or ablation, electrophysiologists may place an implantable cardiac device. For instance, bradycardia is usually treated with the placement of a pacemaker. Several different tests can be done during an EPS, such as take a baseline measurement of the heart's electrical activity, send signals that cause the heart to beat faster or slower, give medicines to see how they affect the heartbeat, map the heart determining the best location to apply cardiac ablation, and then perform cardiac ablation. Last thing to say is about Holter monitor. Holter monitor is a wearable device. It's typically worn for 24 to 48 hours to measure and record the heart's electrical activity after EPS.
That's quite informative. Lastly, what nursing interventions are necessary before and after an electrophysiology study, and how should patients be monitored post-procedure?
Well, nursing intervention before and after procedure include communicate with the patient, educate and explain the procedure to patient, mark and palpate peripheral pulses, make sure that antiarrhythmic and anticoagulant drugs are discontinued as prescribed by the physician. Due to the long duration of the EPS process and the fact that the patient is fasting, the condition of the patient should be considered in terms of hypoglycemia. Cardiac and organ leads should be replaced for cardiac monitoring. The pulse oximeter device should be used and the probe should be assigned to the patient. And trolley and resuscitation equipment should be prepared and made available. During ventricular arrhythmia, the patient's hemodynamics should be stable, and if ablation is to be performed, the source of the arrhythmia should be mapped first. The patient is taken over by the recovery nurse after checking the following items: checking the absence of bleeding, hemodynamic report, open IV line, checking the level of consciousness, and the presence of pulses. The patient should be connected to the monitoring device and monitored for blood pressure and electrocardiogram. After pulling the arterial sheath, the patient must have complete bed rest for 4 hours and the organ must be immobile. It should be explained to the patient to stay MPO for half an hour after performing EPS, and after that should gradually start liquids, and if liquids can be tolerated, start a diet. Lastly, the patient should be monitored for complications.
Thank you for shedding light on this crucial aspect of cardiac healthcare. We appreciate your valuable insights.
You're welcome.
That's it for today's video. In the next video, we will talk about pacemakers. So don't forget like and subscribe to our channel. Stay healthy, stay informed.